Hi. I'm Priscilla Marbell. I am originally from Ghana. I started my career in medicine, relocated to the US, and I pursued different career in public health, and I specialized in health coaching and health education. And in the past almost 10 years, I've been working in different aspects of health coaching. I am board certified in health coaching, and I'm board certified in lifestyle medicine. And my areas of interest include weight loss, diabetes prevention, diabetes self-management, and most recently, heart health and menopause management.
Thanks, Priscilla. We're so lucky to have you on our team. Dr. A, do you want to introduce yourself, please?
So my name is Wael. I'm a board certified family physician. I've been practicing for 21 years, 12 years of those as an educator, as a assistant professor of family medicine. Most of my care has been in chronic disease management, especially in the immigrant population. I worked with the underserved for a great period of time, and I saw different ways that people fail in the system of insurance. So we created a membership-based platform to be able to afford affordable, direct consumer primary care with a specific focus on weight management, because weight does affect many of the chronic conditions that we have. And so we formed this allegiance and partnership with Terra Health Coaching and Priscilla and Cecilia, because we found that the collaborative model works the best for patients. By understanding the patient very well, we can tailor the care and customize it in such a way that we meet the patient where they are. Instead of trying to create a program for everyone, we try to create a customized program for each individual. And even though we see fewer patients this way, the outcome per patient is better. And we would rather see better outcome than volume, because that will actually help people. And then through this education knowledge, we hope that those patients take knowledge and share it with others, and therefore compounding and increasing the effect of our program.
And my name is Cecilia. I am COO of Terra Health Coaching. I met Dr. A at a conference last year, and we came up with all these different ideas together, and it's just been a great partnership ever since. And I'm the first contact with patients. My favorite part about working with Terra and Dr. A's clinic is that it is a very personalized program, as you said, and I love seeing the progress within each patient because of the highly personalized approach that we have. We really get to know each patient, and it's really special to see how much progress someone makes with the right support and guidance.
I think it's the transition that I see happening, right? The changes that I see happening, right? Most of the time in the first session, they come unsure of what to do. This is almost like, oh, is this another weight loss program? Because most of them have tried different things before coming, and seeing them week by week as we, go through the process, go through the lifestyle medicine, pillars, and they identifying the areas they want to change. Then within like 5 to 6 weeks, they come back, they are sharing wins. I can, I'm sleeping better, I'm feeling better, I'm drinking more water, even before the objective, number on the scale, right? But so in addition to that number, they're seeing weight loss, just the non-scale aspect, which is, transforming their life. That's a beautiful, occurrence for me, right? That it's not just about the number of the scale, because that can, people can get obsessed with that. But the fact that their whole life is also changing, that makes this whole, process exciting for me.
I started this program in mid-January, and Priscilla was actually one of the coaches who began early. Even I used her as a coach, so I can attest that this is excellent at helping you understand your diet, your exercise needs, cost reduction, and all the different ways of achieving what you want to achieve. And the problem has always been, for me, was consistency. Is enough time to create consistency for you. Yeah. The other aspect of it is that we have seen that many of the patients have had care in many, many years who have come in weight 220, 230, 250 and above, have lost 30, 40 pounds in 3 months on this weight program, complemented by GLP-1 and medications. And you see not just the progress, the mental aspect of it. The patients are so happy. Yeah. They have commented, like, I've never had care like this. Yeah. Nobody has been this invested in me. Nobody has helped me reach my goals. I never felt heard. You see, just all these comments that I have come across in my career from other people. But here, because it's concentrated, we hear it more, and it is very pleasing, as a physician and as a team to see the progress of patients consistently. And because before, when you were doing things haphazardly, with no organization and no program, you would only see patients in what I call disaster medicine, when you see the effects of disease rather than try to promote health. And this program allows us to promote health and keep it there long term, which really should be the care that we give to patients. And so this program together, I hope, will be successful for everyone. So I'm very happy with that, with this program so far. We've seen people cut their A1C down 1 full point. We've seen patients correct blood pressure. We've actually removed patients from blood pressure medication. We've seen patients' anxiety, depression, fears improve. People's sleep improves. Their ability to do fitness improves. Joint pain improves. Liver function enzymes fall. Cholesterol profiles improve. Everything that you want to see successfully, we've actually done. And that's a really good feeling for a physician.
There's so many factors in place that we really meet the patient where they're at. We try to make it as accessible as possible. It's virtual and in person, so there's the combination of getting that support to adjust to your lifestyle. There's a lot of flexibility within scheduling, so we're really meeting the patient where they're at, and also taking into account the cultural factors. Are you a mother of 3 and have a full-time job? Do you have certain cultural aspects happening in the household because of or you come from an immigrant family, and is grandma in the house and you all cook together? What are the cultural factors involved, and how can we all make changes together? So that's something that we're also considering is, the environment. What are the stressors in your life? So it's not just about changing your diet and exercising more. There's a lot of other nuances coming into place, which is why the behavior change has to come in small steps.
One of the things in listening to Dr. A and the mindset shift, right? It's been very interesting to hear from some people that, so for one, I believe that the knowledge we impart to them is really important. I had one person that after we talked about what healthy eating should look like, subsequent session, she keeps saying, wow, she had never heard about this before. This is, a middle-aged lady. She had never heard about healthy eating. So that change was really important to her that, she can hold on to, right, for the rest of her life. So that knowledge has shifted her mind towards food, and, she's keeps making progress in the right direction for that. So
it's very nice to see us correct misconceptions about nutrition and food, even my own misconceptions about food. Much of our food now is very processed, and we're eating much more synthetic products, artificial things, which are unknown and indigestible by the human system. And returning to basic organic foods and foods that are healthy, and not having an understanding of those foods and what each one does for you. The knowledge it's better than a 4-year degree in it, because you're getting everything. You're getting everything in a year, compressed. So that knowledge, by being compressed, is something you can act on right away. As soon as you get it, you're acting on it. So then you're seeing the follow-up in a week, and then the next week. So I think the ability to process this information and put it directly into practice without having to wait long periods of time can help you get to your endpoint faster. And you can see the change within a month or 2 or 3. And I think that will satisfy most people's ambition to lose weight and feel healthy.
So Dr. A, what would be the first steps to sign up? if someone is interested.
If you call us or go to our website and review the membership and review the weight loss product, you can also go to Terra Health Coaching. We are doing this in conjunction, and they have the weight loss questionnaire to see if you're a good fit for this model and this membership. You see, make sure that you qualify, and if you are motivated enough to want to do this with your spouse or your family, we do have a discount program for families. And if you sign up before July 31st, we're taking 30% off. And then each additional person beyond 3, 50% off. So that will motivate you and your family to join. You're going to get a price point that is unbeatable, I think, and should motivate you to want to change and lose weight. So by the new year, you're looking and feeling your best, whether it's for a new job, for graduation, for New Year's festivities, for travel, whatever it is that you want to look good for or feel good about. This is the right time to do it.
It's never too late to start, and you'll be thanking yourself in a few months when you have started. And once you do meet with Dr. A, and if it is the right fit for you and possibly for your family as well, you would meet with me. We'd have a breakthrough call and really discuss your motivations. And I'd pair you with a health coach, Priscilla being one of the options. So you've already gotten an idea of who our coaches are. And basically, you would start the journey from there, getting support from Dr. A and his clinic in conjunction with our support at Terra Health Coaching. There really is so much benefit in just getting started and having the support. Obviously, we have a family discount, and we know that it's much easier to make healthier changes when you have other people doing it with you and you're in community. That's okay if you're entering yourself as well. The whole point of this program is to feel that you're a part of something and that you have that support and community. So we combine the clinical plus lifestyle integration, which has much stronger outcomes. And just to touch on the fact that we use the GLP-1 medications, it may help reduce appetite and help with a number of other things, quiet the food noise, but behavior change is really what builds the lasting results. And the coaching provides the accountability and personalization and the emotional support that we need to make decisions that are aligned with who we want to be. So as a result, you feel more empowered, more educated, less overwhelmed, and you feel really a part of something to help you achieve your goals. So the next steps, you can contact Dr. A's office and we will get you connected and get you started. So thank you so much.
Thank you very much for the opportunity.
Thank you.